Hello, and welcome to the Responsive Family Sleep Podcast. I'm your host, Kim Hawley, holistic sleep coach, lactation consultant, peaceful parenting educator, and mom. If you've ever felt overwhelmed by all the conflicting sleep info, frustrated with sleep information that just plain felt wrong, or search desperately for a truly gentle and responsive sleep approach, then you are in the right place. In each episode, we'll be answering your most pressing baby and toddler sleep questions, busting those sleep myths, and helping you understand truly developmental, biologically normal baby and toddler sleep, plus encouraging you to trust your intuition along the way. Let's get started. Hello, and welcome back to this week's episode. I have been wanting to do a podcast on this topic for a while, and so I'm so excited to have a guest here with me to be talking about postpartum or perinatal mental health and just the ways that it shows up in sleep and parenting, and the way that we support our baby sleep, our own sleep, and just all of that messiness. And it's such an important conversation that we really need to bring so much nuance and I think compassion too. So, Emma, thank you so much for joining me today and for being here for this conversation.
I am so happy to be here. Thank you for having me. I could talk about this forever. So I'm glad we're going to have this conversation together today.
I bet. So, funny story before I let Emma introduce herself is that Emma and I connected way back when I first got into sleep work. And we were just talking about this before I hit record, like 2017, right at the beginning, when I was starting to get into this work. And you had just moved to DC pretty recently then, right?
I had just moved to DC. My kids were little. I had basically a newborn and a 3-year-old. So I think that's
Ah.
partially why I can't remember what year it was, but
We're just thinking about that how long ago we connected, and then here we are talking today in very different places for both of us with our work, and yet so much of the same things coming through. So, with that, I'll let you introduce yourself and tell a little bit about the work that you do. Um,
awesome. I'm Emma Basch. I'm a licensed clinical psychologist based in Washington, D.C. I specialize in perinatal and reproductive mental health. I run a group mental health practice called Dr. Emma Basch and Associates. There are now 9 of us.
wow, really? I
Yeah.
knew your practice had grown, but I didn't realize that big.
Yes, we just brought on number 9, and we are all women, moms, therapists who are passionate about perinatal mental health. So this is what we do. We serve clients in about 40 states and some other countries. Anything in the perinatal and reproductive kind of stratosphere is the work that we love, and we are a passionate group of women who could talk about this forever, which is part of why I was so excited to have this conversation. I'm also a mom of 2, so been there, also managing sleep, mental health needs myself, and certainly that's one of the many reasons I stay committed to this work, is to help other moms.
Awesome. I love that. So, where do we start? We start with kind of I think laying the picture a little bit with
Yeah.
postpartum mental health because there's so many ways it shows up and so many ways people experience challenges
Yes.
with their mental health during the perinatal period. So,
Totally. And I would argue, this is not like a clinical term, but that everybody has some sort of postpartum adjustment concerns, because how can you not,
it's
right?
huge. It's such a huge shift.
It's a massive shift. Everything, body, mind, identity, relationships, everything changes. So I think, of course, it's a time that is just, ripe for opportunities for there to be challenges and, wonderful things as well. When we think about perinatal mental health or postpartum, I'm using those words interchangeably here, but we're really talking about mental health concerns that sort of come up during pregnancy or postpartum. Sometimes the shorthand is to call it postpartum depression, but really there are a variety of mental health concerns that can show up: depression, anxiety, trauma, OCD, to name a few. Sleep and sleep disturbance is indicated in all of them. But I think, one of my things I love to do is just educate people more broadly that these are common concerns, they are treatable concerns. My favorite sobering statistic to share is that perinatal or postpartum depression or anxiety is the most common complication of childbirth.
Mm-hmm.
Um, which, if you think about it, it's not entirely surprising for exactly the reason we said, right? It is a massive adjustment. And you add to that hormones, lack of sleep, identity and relationship stuff, you have sort of a breeding ground for folks to have a really hard time.
And I feel like, especially in modern Western culture, where you also have a lack of support,
Yes.
appropriate support, appropriate financial security in a lot of jobs to recover, to bond with your baby, to figure out all those identity shifts. And it's just, especially in this country, it's a whole nother layer of like complication. Like we weren't supposed to do it this way.
We were not. I often say to folks, like, point the finger at the actual bad guy, meaning stop blaming yourself for things that are sort of systemic or societal problems, right? That like
Yes.
a lot of the challenges we have are a function of the systems that we are in. So I completely agree with you. Like modern society and the expectations placed on us and the limitations placed on us make this extremely difficult.
Yeah. Yeah. Because like in an ideal world, we'd have these beautiful support systems. We'd have like ample paid time off, right? To find our feet, to get through like at least the
Yes,
newborn crazies and like the early months of, challenging everything, like figuring out a whole tiny human that you're responsible for. And yet so
totally.
much of us don't. We have so many additional stressors, and
Absolutely.
lack of
Absolutely.
resources.
Totally, totally. I think, obviously it affects people differently based on, level of privilege and level of support, but I would argue that nobody has what they need when really what we need is ample financial resource, time, space, compassion, and then, I would add in like, normalizing and making health supports a lot more accessible than they are.
Yeah. Yes. I would totally agree.
Hmm.
So, thinking about the experience of grappling with that transition into parenthood, how would you like help people see when it's sort of more average struggles versus maybe kind of, I don't know if urgent, clinical, I'm not sure the right word there, but
Yeah,
like
for
I feel
sure.
like sometimes I get parents of older babies or toddlers who look back and they're like, oh my God, I'm pretty sure I had postpartum depression and didn't realize it.
Hmm.
And that's why I was struggling so bad with my baby sleep around this age. It was actually because my mental health was just, I needed different supports and I didn't realize it. So how can parents maybe realize some of that or realize it in their bestie or their sister, or, that kind of stuff, their partner?
Totally. It's really hard for exactly those reasons, right? That like, it is really normal for us, like this continuum of challenges that we all have in the postpartum period. So to kind of understand like when do I need additional support and when is this sort of something that's going to pass is really nuanced. I,
Hmm.
I always say a couple of things. One, it is always worth getting support, even if you think what you're experiencing is in the range of normal, because you can still get help and you can still feel more easeful. So that's like my line one. But I also understand, making time and having the resources for therapy is not available to everyone. So sometimes we have to be sort of judicious around it. I think with folks around symptoms, intensity of symptoms, duration of the symptoms, right? So you could have a symptom like feeling irritable that's like really, really normal, right? Most people are going to feel irritable at some time postpartum. But if you're feeling irritable most days, if it's interrupting your relationships, if it feels extremely intense, right, then you may need a little bit more support, right? So these things that we would say are sort of a normal part of that period, if they're really intense, if they're happening all the time, if you don't really get a break from them, those are good reasons to seek additional support. For folks who have a history of anxiety, depression, or any mental health concerns, trauma, I think getting additional support can be helpful because these are really vulnerable times to essentially relapse in
Hmm.
symptoms. So those are always times where I say, okay, it's worth getting checked out and having, a meeting with someone like me, even if it's just a check-in, right? Like, how am I doing? What should I be looking out for? Stuff like that.
Yeah. Yeah. Maybe, I mean, even if someone's pregnant, like planning that ahead of time, right? For
Yes.
the postpartum period. Like I know some of my close friends who have a history of like anxiety. That was part of their like postpartum planning, was making sure they had all those supports in place.
Totally. I love recommending that for people if they're willing to do it, is getting, having at least a consult before you have a baby for a couple of reasons. Number one, we actually know a lot of symptoms start during pregnancy. So if we can get in there and help during pregnancy, people are going to do a lot better postpartum. But
Hmm.
also, who wants to find a therapist when you have a 1 week old and you're recovering, right? Like that is
So
the
true.
worst time. So having a point of contact, right, that you know or can help you out is just going to make your life easier if you need to check in later.
It's so true. That's so true.
Mhm.
I feel like in the work that I do, I'm do a lot of like trying to screen where people's stress levels are, right? Because I'm not a therapist. And yeah, I do a lot of regulation work with the parents that I work with who are open to it because, sleep is literally all about regulation amongst other things. But, just can we use tools and are they effective, right, for your stress? Like, is some reframing effective? Is some mindfulness effective? And then, like, there's the people that's like, is this so not just what you need, right? Like, you need a
Like a
higher level of support than like general stress management
Mhm.
skills. And I feel like sometimes that's one of the ways that I start to tap into this parent is not coping well when it's like, okay, the parents that tend to cope or who are coping better, who might be stressed, but like we'll talk about like, okay, let's brainstorm some stress management tools. And like they work, right? And when they don't work and the parents trying to use them, then I'm like, I wonder what else is going on here that hasn't come out yet.
That I
You
think
know?
that's a great point, and I think it's something for folks to pay attention to for themselves, right? Because also, I feel like for most of us postpartum, some of our typical coping strategies are not always available to us because
Hmm.
we are physically recovering, perhaps we have limited time, we have limited sleep, and so sometimes people have to rely on new or different coping or regulation skills.
Yes.
So that can be challenging. But I think, right, that's certainly right. If you are a parent, a new parent, and you're noticing that your coping strategies are not working well, again, the problem's not you or you're not doing the strategy wrong. You need extra support,
Yeah.
right? Or the other way I would say it is if you feel like you have to spend your whole life sort of just like trying different strategies to ground and cope, get some extra support so you can be in
Yes.
your life, right? And not just managing all the time, but really living.
Oh, I love that right there.
Yeah.
And thinking about that with just myself, not in the perinatal period, but like my husband always jokes when I can't run, like my mental health suffers, right? Like not in a clinical way, but like you can tell. And like I hurt myself running earlier this
Oh,
year.
no.
I totally screwed up my hip. I was like, they thought it might have been a stress fracture. It wasn't, but like I was like super restricted activity and then like it's been a really slow getting back into running.
Yeah.
And he was just like, you can tell the difference when I am able to be active enough versus I'm not. And so I feel like that, like with the postpartum period, when like something like that, maybe it's not time to get back to running because your body is still healing. And so,
Mhm.
like being aware that, like, hey, I know this is key for me and I can't access it right now for really logical, sound
Yes.
reasons. I feel like it allowed me to be more compassionate with myself when I'm like,
Right.
why am I finding this so stressful? And when my husband, he's articulating out loud, like, hey, I am recognizing this. And so I can give a little bit more space that like your favorite activity stress management tool is not accessible. It'll come back, but it's not
Right.
accessible right now. And then like, okay, what can we do
Totally.
that's actually accessible when I'm activity restricted, right? And I feel like it's so much of that with parenting. Like maybe you can't do something because your baby's too young or because you're recovering, but then what other things might work? And if they're working, wonderful. And then if they're not, how do we get more support?
Yeah. Totally. Oh my God, I'm a very active coper myself. So I notice the same thing if physical activity is not available to me. That's one thing I like to think about with clients who are pregnant, right? Just kind of recognizing what are your coping strategies and let's think ahead about either how we modify them or how we connect with like what's important about them that might be accessible a different way. Like for example, with running, like is it the being outside? Is it the heart getting the heart rate up? Is it right? Like we can't obviously it's a unique experience to run and we're not going to say this is the same, but if we can understand, okay, this is the really important part of it, maybe we can get you something similar postpartum.
Yeah. Yeah. And I don't know if you see this with the parents that you work with, but like I know for myself, it's like remembering that like I'm not never gonna run again, right? I am just right now, like this is going to pass. So like even if it's not the same, this is
Mhm.
like my now strategy.
Yes.
And I'm not in a place where long term I'm losing this strategy necessarily. It's just a matter of like shifting what we can do for
Yes.
now, and that's going to shift over time, which I feel like is so true about things you can do with like things you can't do with a newborn,
Yeah.
that then you have this ever expanding like ability to bring things back in as babies get older, become toddlers, kids get older, like that, you know,
Yeah.
ever changing
Totally.
space.
I think it's like one sort of easy way to help folks remember that if they're postpartum is like look at your baby, right? Your baby is changing all the time. And in adulthood, we're not normally looking at things like 1 week, 2 week, right? In the way we mark baby milestones where we're measuring the number of weeks old someone is. But it's a good reminder around mindfulness and presence and how much things change for us as adults as well, right? That things are, transitory and they will shift. That doesn't mean they'll shift back to what they were, or things will be the same, but whatever you're in is not what you're always going to be in. It just can't exist that way.
Yeah. Yep. And each new phase brings new challenges, but also new opportunities and sometimes new views and perspectives on
Mhm.
things that I feel like we get stuck in a lot of parenting things. Like I think the messaging gets us stuck, right? That like this is how it's always going to be, and you
Mhm.
have a small window of time to get it perfect, or you're like just screwed forever. Like just
Yeah.
really catastrophizing thinking, messaging, and really fear manipulating messaging is very common
Mhm.
around baby care in
Yes.
general, but sleep in particular.
Yes.
And it's just it's so wrong because it's so untrue and because it just sets parents up to struggle
Yes.
more during an already objectively hard time for a lot of people.
Totally. And blame themselves when things are going a particular way. I see so much anxiety about that. And I agree with you. I think sleep is a place where there's a lot of that messaging, right? If you don't get your baby sleeping this way by this time, if you don't establish this habit by this time, it just scares parents, right? And puts so much pressure on this time, that's already so stressful. And of course, it's also not true and not how babies or people operate. But
Like if only habits formed that quickly.
I know, right? And if
Wouldn't it be
only
so much easier as an adult to form new habits?
It would be
Like,
so great. And if only babies were predictable machines that did exactly what the book said, but that's not how this works.
they are not robots, they are humans, and they are
They are
immature
human.
humans at that.
That is true. That is true. It absolutely
Say
puts
that a
so
lot.
much pressure on all of this. Oh, I love that.
Yeah. I want to talk a little bit about sleep and mental health.
Yes.
Right. And I want to talk about baby sleep and parent sleep and mental health. But first, I want to talk about this idea of like the bi-directional relationship between sleep and mental health, right? That like,
Mhm.
yes, sleep deprivation can worsen our mental health, but then depression, anxiety can worsen sleep, and
Mhm.
it can become a feedback loop. And like, it's just, I feel like we as a society super oversimplify
Mhm.
this piece.
Mhm.
That what I hear a lot is if you're struggling with your mental health, the only option is to sleep train your baby so that you can get more sleep. And I
Mhm.
feel like that says a huge disservice to people because that's not the right solution for a lot of families. It doesn't
Mhm.
work for all families. And it
Mhm.
just shuts down any like creative thinking, but sort of from the sleep side of things, like kind of that space of sleep and mental health, like that interconnection, I think is so fascinating.
It's such a delicate thing, right? Sleep is so delicate, right? And anything can sort of throw it in one direction, but you're absolutely right. It is this bi-directional thing, right? You could sort of see like sleep challenges of any type as a symptom of a lot of mental health conditions, certainly in the postpartum period. Like I could list off, what symptoms we put under postpartum depression or postpartum anxiety or whatever, and like problems with sleep is always in there. And sleep is also the intervention we want to give, right? When people are struggling with their mental health generally, but certainly postpartum stuff as well. Helping people get good sleep is important, but it's also really nuanced. Tell an
Yeah.
anxious person who's having trouble sleeping, you got to get good sleep. I can guarantee you they're going to sleep worse because they're going to get anxious about their sleep. So it is a really nuanced, complicated dance that, like, yes, it's absolutely vital. But we have to think about it holistically, creatively, flexibly to serve everyone and ensure that people are getting the sleep they need. I always like to give this one little caveat, just be in my role here, that for postpartum folks, around postpartum psychosis, not a
Mm,
common thing, right? Very, very serious. But there's a big sleep component there, which is why I want to flag it.
yeah.
So, like, just for psychoeducation, for newly postpartum folks who are not sleeping at all and feel like they have no need to sleep, right? Not like I can't sleep because my baby's crying, but there's sort of that like manic energy. I don't need to sleep. That's a medical emergency. And we need someone to get to a doctor, get to a hospital, and get treated because psychosis can develop out of that. It's very rare, but it's always serious. So,
Uh-huh.
I always give that caveat for postpartum folks or people working in this field that like that's a different animal that we got to treat differently.
Yeah, because that's not anxiety keeping you awake. That's like a totally different
Totally different.
piece.
That's mania or psychosis keeping you from thinking that you need to sleep. Totally different piece. Yeah.
Ah, I'm so glad you flagged that. That's not generally on my radar, so I'm so glad that you flagged
Yeah,
that.
it's nuanced and it's rare, but what I find sometimes is someone in an emergency is not necessarily seeing a therapist, but maybe they're seeing a sleep consultant, or maybe they're seeing a doula, or maybe they're seeing whoever, and I want that person to know what to look for too.
Yeah, yeah. Because I see a lot of anxiety preventing sleep, right? Whether it's like ruminating about the next wake up or how terrible sleep is, or like fears around their baby's sleep, like that kind of stuff, keeping the parent sleeping. So the baby is actually asleep,
Yeah,
but the toddler's asleep,
right.
and the
Parents are
parent is
frustrated.
laying there spiraling over something or another
Yes.
and not able to sleep. And so I, especially with families who know they have a history of mental health challenges or has like identified to me that they are struggling with anxiety or, depression. First of all, I love it when they come in already working with a therapist. That's like
Yeah.
happy days for me. If they disclose it and they're not, and I don't feel like it's well, and then I'm like, you need to get a therapist. Like I need you to, I need you to have mental health care support. Like,
Yeah.
because I am not a therapist, and that I feel like is so important. But it's like that ability to think about like how do we help you sleep, but also how do we do that in a way that sort of fits your values for why you're working, with me as a sleep coach, but not a sleep trainer, right? Um, and like how can we protect some sleep for you as
Right.
the parent without it being at the cost of your baby's needs that are also valid. And if you're breastfeeding, if you're a nursing parent, and not at the cost of your supply, right? If that's something that's important to you to continue
Totally.
doing, which is another piece I feel like gets lost a lot in the sleep world, broadly speaking. Um, but that balance, right? Like, are we not sleeping because of how many times your baby's waking up, or are you not sleeping because you can't fall back asleep
Right.
afterwards?
Right. There's
And
so
where
many
what's
ways
going
to get
on?
totally, we got to get creative in there because what we would do there, depending on what's going on for someone, would look so different, right? Certainly, if like anxiety and rumination is a piece of this, we would do something very different, right? Than if it was something else that was animating the lack of sleep. I think, right, I see families as a system, right? And
Yes,
everyone
me
needs
too.
in a system, like they have to be important. And they get positioned as sort of like antagonistically. And it can feel that way, right? If you've ever had a baby who's not sleeping and you're exhausted. But if we think about it that way, it can work against your anxiety, right? It can make you feel worse. It's actually not helpful to the system, even if it can feel that way. So we have to value everyone's needs within that system and everyone. And I think also think critically about that decision making, right? Like for some folks, it's appropriate to help them, think about adding, let's say, a formula bottle and not, and, ease up on being concerned about their supply because of a level of anxiety. And for some folks, that's not where they're at, and that's not the right intervention. So it's got to be system specific.
Hmm. And informed consent, right?
Yes.
I I love therapists. I'm prefacing that with I love therapists, but not all therapists working in the perinatal period are knowledgeable about normal sleep, attachment, bed sharing, and lactation. And these
Yep.
are the topics that I tend to see sometimes misinformation.
Mhm.
coming from therapists and many other providers, right? Not in no way, shape, or form hating on therapists
Mhm.
here. But like also that like that informed consent piece. Like, yes, it is okay to do a bottle of formula if your partner is actually going to do that night feed for you, right? Or is that creating more work? But also, is your breastfeeding relationship a huge protective component for your mental health? And therefore, and maybe you have a fragile supply, and that one bottle and that longer stretch of sleep could be the thing that tips you into not
You got
into
it.
like your supply going down. And
Got it.
so like there's so many pieces there that I feel like aren't one size fits all. And of course, societally, we want this one size fits all solution.
Mhm.
And it's
I-
like,
oh
it's
yeah.
not, it's not because, you know, there's layers and there's different people prioritize or I don't know if that's quite the right word, but like, for some people they're like, oh, my breastfeeding relationship, like it's good, but like, if shifting this gets me more sleep, like I'm okay with my supply dropping some. And some people that's like so vitally important to them. It's such a essential part. And there's no value judgment there. Like it's really just how do we look at all the pieces and how they interact for me when I'm looking at like these types of decisions with parents from the not therapist side of things.
No, but I think you're right. And I will tell you that like one of the things that gets me all riled up is when anyone, be it a therapist, a sleep consultant, a whoever, a medical provider, prescribes a one size fit all method or a one size fits all book or Instagram account, do this and this will happen. Like that to me is a scam.
Yes.
Not like it's just we are, as you said earlier, we're not robots. We are humans. Babies are humans. We have to work within the systems. I think the idea of informed consent with everything is vital and really trusting parents, empowering them with information to make these decisions and choose their values and
Mm-hmm.
understand why they choose their values. Like I look at, I have two children with my daughter protecting that, my older child, protecting that breastfeeding relationship meant a lot less sleep, but it was vital to my recovery from birth trauma. It was
Yep.
a huge thing for me. That wasn't my experience with my son. It was still a huge part of our relationship. I nursed him for a very long time, but it meant something different. And so it
Exactly.
invited more flexibility. And if that was missed, they would, so by a therapist or a lactation person, they would have missed me, right? And how
Yeah.
I was going to
Yes.
be as a parent. So I 100% agree with you, and that's a great conversation to have with yourself as a postpartum person or as a new parent as well, to like understand your own values and your needs without judging yourself, without any prescriptive, recommendations around it, but like what does it mean to you and why, right? Why does that matter to me? Not in a judgmental way, but in a curious way, so that whoever is supporting you or in your own work, you can really center the things that matter.
Exactly. Exactly. And then it does change between kiddos, right? Like I think that's so true. And how our birth kind of and pregnancy impact those feelings, like how we identify with different parts of parenting. Like it changes, right? Like it shifts. And that's okay because it's all interconnected.
Absolutely, and the systems are all interconnected. Not to get on a tangent, but I have a lot of patients who struggle with that shift, right? Feel judging themselves. Oh, I bet I felt this way with my first, and this way with my second, whatever it is. And those things are supposed to change. You're changing, your system's changing, right? Again, if it was one size fit all or it looked exactly the same, you would not be doing service to yourself as an individual or to your individual child that you are parenting in that moment. It's just always moving.
And I try to encourage parents when they had a really intense first child to like do some work to process that before having another kid if they can, right? Like if we're in a space where that's possible, or just to debrief on it, even if that second baby is already on the way or they're already here, because temperament is such a huge piece of sleep.
Uh-huh.
And so if you have a highly sensitive or very persistent, very intense or low sleep needs first child, that doesn't
Mhm.
necessarily mean you're going to have that in your second child. And so if we carry a lot of that baggage in, just like, ideally we process a birth before the next birth and don't carry that baggage in, it can really skew your decision making and how you're thinking through things. Because if you're like, oh my God, I really love nursing to sleep, but like it was so hard to stop with my first, and I felt like they did forever, and at the end, I felt like I was held hostage by it. So I'm never going to nurse this baby to sleep, right? Just for an extreme example. It's like you're robbing yourself out of so many moments that you actually enjoy nursing your first to sleep and probably making your life harder, right?
Mm.
Because we didn't really unpack that first experience and recognize that these are different babies.
Right.
And
Right. And that you're a
I,
parent.
yeah. And so I feel like it's so tricky. It's tricky when your first is really intense. It's also tricky when your first is really easy and your second is really intense because then you're like, what? What is this? You know?
It's such a lesson again in like in understanding that flexibility and acceptance have to be a part of this journey.
Yeah.
Otherwise, that rigidity is going to cause you to fall, right? Like I think you're absolutely right, right? Of course, any experience we have is going to shape our feelings about a subsequent experience. So
Yeah.
your experience with that first child is going to, shape how you think your experience is going to go the second time. But doing some work to understand that is really helpful so that you don't get fused or rigid. Temperament, I'm so glad you bring it up, right? Of course, it's a huge part of sleep, but I think it's something I find a lot of parents sort of think that they are more responsible for some of the things they're seeing in their children that are really temperamental. Not that
Yes.
huge
Yes.
impact on their kids, but the temperament, like they come out that way. Um,
Yes.
so,
Yes.
and I think it's an important one to name as people working with new parents, an important one for new parents to just kind of understand that, we like to think we have maybe more control, but some of this stuff is wiring, right?
Yep.
This is just how that baby is wired. We got to work with that wiring. We're not going to change that temperament, nor did you do something wrong to have a
Yep.
particular temperament. It's just wiring.
Yep. We don't create these sensitive, higher needs, more wakeful babies, right? They are it's what they are. And we have to parent within that. And so I say a lot when we're talking about realistic sleep expectations, I'm like, it can look realistic on paper
Mhm.
for an average baby. But if you
Mhm.
have a highly sensitive baby, your
Yes.
sleep journey is going to be different, right? It is just going to be different.
Mhm.
Honestly, no matter what types of strategies you gravitate towards, because no strategy is a guarantee
Totally.
across the entire spectrum of ways that we interact with kiddos and parenting, not just kiddos and sleep. And
Yes.
so it's just like temperament is such a big piece. And then, if you have a baby that has any added like medical things going on, then that's
Yeah.
another piece. Like we can't control these things. We kind of have to lean into some radical acceptance of this is our journey. Now let's make it the best it can
Right.
be within that context. And that's hard. That's some hard work there.
It's really hard. It's really hard because it does mean that combination of acceptance and also like letting go of some beliefs around control. And I
Yes.
think people can get surprised. People can get surprised in the other direction. Like I have seen patients, but also just friends who end up, with that first child that is temperamentally pretty even and sleep goes pretty well, and they conflate whatever they did as like this is why, right?
Yes. I
And
see
think,
that all the time.
right?
Like
And
all the time.
yeah, like your baby was just a good sleeper. I don't mean to rob you of the cookie that you feel like you get for whatever you did, but your baby was just, easier to regulate or had an easier time regulating themselves. And that's, can surprise people. On the flip, I see folks who feel like they're like a bad parent or they're doing it wrong because their child's
Yes.
not sleeping well. And like that doesn't, no one is a good parent because your kid sleeps for 10 hours, right? Like
Yes.
you're just a parent and your kid is just a human who is learning how to do this thing called sleep, right? And
Yeah.
developing.
Yeah. And often with that overlay of unrealistic expectations for their capabilities, right? Like that's, I think, the biggest thing with sleep is that almost every mainstream way that we talk about sleep is not actually grounded in appropriate developmental expectations. And so it complicates everything. If
Mhm.
you think your baby should be able to do these things, but these things are fundamentally not developmentally appropriate. And yes, a small percentage of babies can do it, then you're
Mhm.
just like, especially if you already have some mental health struggles, like that's just gonna, it's not helpful.
It's not helpful. Expectations are, always something like whatever we're talking about. If your expectations are misaligned with reality, it's not going to go well. I wonder about that a lot. And I know this is much more your area of expertise, so I don't have the knowledge. But when we started telling parents the things that we are telling them about these expectations about sleep that are not developmentally backed in how babies operate, and I don't know if, I mean, I know we've done this for a while, but I do wonder about, right, with Instagram parenting and like these just sort of oversaturation of misinformation, if that has made this problem worse, that people's expectations are just totally misaligned.
So I love that. So like all the mainstream expectations you can trace back to the late 1800s and the rise of pediatrics.
Ah,
Yeah, it's all the stuff, right? Industrialization, urbanization, efficiency, productivity, get these parents back to work, totally product of capitalism. But it's
capitalism.
also
Yeah.
a product of pediatricians establishing their place. So just like we have the whole medicalization of childbirth, right? That like no more midwives get birth under obstetricians and in the hospital. We get this sort of pediatrics being like, we're the parenting experts. But it was like old white men who knew nothing about parenting, right? So they're just like spewing ideas out of their head with no bearing on anything. And like seriously. And then it evolves over the 1900s. But all of these, like you can spoil a baby, night feeds are bad, feeding to sleep is bad, babies should sleep through the night, consolidated sleep is what they need, get them as independent as soon as possible. Like all of these beliefs that we still have in mainstream about sleep, what they should be doing, it all comes from them. It
That is,
all comes from them. And then we get to like, Ferber in the 80s and, all the modern sleep trainers are basically regurgitating and repackaging all those same ideas.
yeah.
And then we get to Instagram, and my oldest is 11.
Huh?
And I will tell you that I remember looking for sleep information when he was a baby,
Yeah.
and it was a very different landscape, right?
Mhm.
It was very hard to find anything that was not sleep training, but it
Mhm.
also, none of that sleep information was in your face in the same way it is now. And so it's like there's so many more high quality sleep accounts people out there now. But there's
Mhm.
also so many more horrible accounts out there now. And there's also so much more deceptive
Yeah.
marketing
Yeah.
that's there being like, look, I'm so lovely and attachment based and holistic. And then you actually look at what they're doing, they're totally doing Ferber, like, or something along those lines. So it's very deceptive about what they're offering you in an attempt to look like they're more developmentally aligned
Right.
with their sleep information. And that is one of the hugest problems. But it is that Instagram and TikTok, whatever social media overload now that's it's been really different over the last, I'd say 5 years or so, maybe
Yeah.
6 years.
Yeah.
I don't know.
I try to, my oldest is almost 11, so very similar. Like it was very difficult to find that information. And then, I have a almost 8-year-old. I noticed it changing. And now I just sort of like to see sort of what are my patients seeing, right, who have new babies. And it is a whole wild west out there. It is
It is.
really, really different, sometimes for the good, but a lot of times I'm really concerned with what I'm seeing and what is out there that just in all directions, that just isn't connected to any science, but also can be really dangerous.
And I think honestly, this is totally derailing off topic, but I think it's an important point to put.
Yeah.
Instagram and social media are not a place to make parenting decisions from because I know I'll put up a post, say like, here's how to move away from contact naps. And then
Mhm.
someone's bitching and complaining about why aren't you saying contact naps are good? And I'm like, oh my God, do you know my work at all? Like, I'm super supportive of contact naps. Reverse
Mhm.
goes, put up a post about like contact naps are always healthy. And someone's been, but I don't want to do them anymore. Why is it horrible to not move away from them? Like, that's not what I said. So I
Yep.
think it's really easy on social media because you have to make these little, like, they're not comprehensive. Even a
Mm.
blog post is more comprehensive, but it's not still not super comprehensive. Like, these are little snippets of information. And I think we can blow them out of proportion
Yep.
and not recognize that this is one very sliver, like, this is one technique or one idea or one perspective.
Mhm.
And all these topics are nuanced. And I
Yeah.
see that, I mean, I see it, and I'm sure you're alluding to that. I see this in the responsive parenting world as well, but I also see people, parents, misinterpreting what people are saying by only seeing little snippets and never actually diving into the deeper work because I feel like no one reads books anymore. And so it's this fragmented pieces on social media instead
Mhm.
of actually understanding that, like, no, literally no one who is a quality practitioner in the attachment-based responsive world is saying that your needs don't matter as a parent and you should martyr yourself. But a
Right.
lot of people walk away with like responsiveness at all cost. I'm like,
Right.
no, no, like literally no one is saying that has
Mhm.
any qualifications in this space, but that
Right.
message is getting out there because people aren't engaging with materials in the same way. It's still much like boom, 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 boom. Anyway, that's my theory. I don't know,
No,
but like,
I hold that theory, and it's something, sleep and parenting, like all of that, that's something I see happening a lot in my practice is people seeing what they want to see, hearing what they want to hear, or mishearing what they're
Yes.
receiving, and coming back to mental health needs, like my folks with anxiety, my folks who are struggling to sleep, I understand that like desperate search, at night for the thing that's going to make you feel better, is going to make your baby
Yeah.
sleep. But all that's going to do is create more anxiety because the internet does not have an answer to you or your baby, right? Like it
Yeah.
just doesn't work that way. So
Yeah.
it does a disservice, I think, right? Obviously, I think the intent of most people, most creators, is probably quite positive,
Yes.
but
Yeah.
right, how it ends up getting received, depending on the person taking it in, just distorts it so much. And you're absolutely right. And the responsive or gentle parenting, attachment parenting, where like so much of it gets distorted in all kinds of directions that are not what it's meant to be, and I think
Yeah.
unfortunately can cause harm, right? To think that, right, a new mom or a parent's needs are not important is absolutely detrimental. Not what people are
Yeah.
meaning, but it's
Exactly.
like a huge, huge problem,
Exactly.
and denies the reality of the system that everyone's needs need to be considered in an evolving, dynamic way.
Absolutely. Absolutely. And just that piece that like I hear a lot with parents like misunderstanding that like they feel like a bad parent if their baby is crying, right?
Mhm.
Like that responsiveness means my baby's never gonna cry, right? And I'm like, that's not what it means, right? Like actually at all. What it means is there's just so many ways that these things get kind of spiraled, and then you layer the mental health
Yeah.
struggles, and maybe that's part of how they're perceiving it. Maybe it's how people are interacting with information more so these days, but it's tough. And you're right. There's not one right thing.
Mhm.
And also, I feel like that's why it's important when you are choosing people to work with that you align with their approach because and the way that they like present information and things like that because there are so many options that it's like I don't necessarily think I'm the best sleep coach for everybody, right? Like, and
Right.
that's okay. And I certainly want to work with people who are the best fit for me because it feels better as a practitioner, it feels better as a parent, and we're going to get better results. And so I think it's really like hard because there's so much information overwhelmed, but like also just being mindful of like that piece that not everyone is the right person to
Yes.
help
For
you.
you. Yeah.
And the internet is talking in generalizations and little snippets of information. And so to
Totally.
remind ourselves not to like take one piece of information and blow it out
Run.
of
I so
proportion.
agree. I hope that when people like sort of stop and reflect back on that idea, right, that like you have to find the right person for you. I hope one of the things that can help people see is there's like a lot of different air quotes right ways to do things,
Yes.
right? And like there's really not a one correct way, just as there's not, one sleep method, right? Working with your family's needs, your relationship with your baby, your style, your values matters. And that's just as right and justified as someone who might do that, a different method that's going to work with a different provider, different strategy that aligns with their values. It's because there's lots of different ways to do that.
Hmm. And back to the temperament piece, temperament affects how what things work for people, right?
Got
And
it.
what the biggest pieces are in any given family. And I think that's important as well, right? That
Yeah.
like, would I love to see a world where we never ignore babies completely and leave them to cry it out? Absolutely. Like I never judge a family for using a strategy like that, but I do judge as a society that that's the first line of defense for a lot
Yeah.
of people. That's what they're hearing.
Yeah.
And I hope that nuance is clear, right? Like families are making the best decisions they can, and mostly what they hear is cry it out. And I do actually would love to see a world where we don't leave babies to cry it out because there are a whole host of behavioral strategies that are gentler
Mhm.
um, than that.
Yeah.
Whether or not someone resonates with my approach to sleep, which is of course way more on the attachment holistic side, but there's
Right.
still so many better strongly behavioral strategies that like I might not use, but like I can fully recognize this is a way better for a baby. But like again, the structural piece, like it is so structural what information we get access to, and how
Totally.
we,
Absolutely. And like, look, as the position I take is pretty like sort of agnostic on people's different sleep methods because it's not my role, right? As a
Uh-huh.
clinical psychologist, and I don't want to practice outside my scope. I can speak to what we know about, what the literature that is within my scope says, right? But that's my literature and not so that's my little caveat here. But I completely agree with you that we have set up systems where people do not get they get information that is siloed or in camps and is very extreme and does not allow for people to get I think a more holistic access to information. And I think for particularly for first-time parents or anxious parents, it really feels very unfair, right? I'm remembering I had my children in New York. I was still living there, and we were at a practice that I will not name, but is fairly well known, where the person who started the practice recommended sleep training as young as 4 or 5 weeks.
Oh yeah.
We would go to the doctor and they'd say, "Is she sleeping through the night?" And I'm like, "No," but I'm a first time parent, right? My, like you don't know what you don't know. And in retrospect, I'm like, oh my God, that was the expectation. We did not do that, right? But the expectation that was, at these appointments was that you were doing full cried out to extinction on a 4-week-old baby. And again, I don't say that for judgment, but like you're a vulnerable new parent. That is what your doctor is telling you, right? It's not fair, right? It's not
I actually do want to take a little bit of a stance on that. You don't have to agree with me, but
yeah,
I
yeah.
think that's negligent care from a doctor.
Yeah,
Like, because that's actually unsafe.
yeah, yeah.
Like, not, no judgment for a parent following their doctor's advice ever, right? Like, absolutely, we all should be able to trust our healthcare providers. But, like, from the provider side of things,
Oh, yes,
I
yeah,
do hold providers accountable. Like, that's negligent.
I agree.
That's not appropriate.
I agree.
And like honestly there are some guide like I do think it's important within allowing parents to make the best decisions given their values and informed consent, all that lovely stuff. From the provider side, there is evidence to support some guidelines around some of the different ways that we talk about sleep, and they frequently don't follow them.
Yes.
And so that's a whole
Oh,
different conversation.
I totally agree with you that like, and that, yeah, and again, point the finger at the right person, right? It's not the
Exactly, never the
parent
parent.
that,
The structures, the
right?
providers, right?
The
Like they should know
providers,
better.
they should know better. And I feel lucky that I had enough background in this to be like, well, that doesn't feel right. And I'm going to trust my own gut and not do that.
Yeah.
But I get that that's not everyone's experience. And, if that's the information you're given, like those are the
What are you
decisions
going to do?
to
Yeah.
make, right? What are
Yeah.
you going to do?
It's tough.
Yeah, I mean, I feel lucky to have access. I think going in, doing the work that I did while I was still, completely sidelined by having a baby, I at least felt equipped to ask questions, um,
Yeah.
which not everyone feels even like they can do that.
Yeah, absolutely. Absolutely.
I'm glad you said that because we should hold people accountable also for practicing outside their scope. And again, not to go soapboxy here, but you alluded to it earlier, and I completely agree with you. Like, if that's not your field of expertise and you don't know it, like, please don't tell someone to do something about any of, right, about their sleep, about their mental health, whatever. It's not great. I see that a lot.
And also, I think that there's a certain amount of this is one of my pet peeves,
Yeah.
right? Is that everyone working in the perinatal period should have some basic knowledge about normal baby behavior, including sleep and feeding,
Yeah.
and about the basics of attachment. And if
Mm-hmm.
you are working with parents and you do not know these things, then you
Mm-hmm.
should not be working with parents
I
in
agree.
this period. So we should all know, right, that you can bed share safely, that it is normal to wake at night, it is normal to feed at night, it is normal to nurse or soothe to sleep, that it is normal for babies want to be in arms, like these really fundamental basic things. That does not mean that parents can't work to lessen things that are hard for them. But
Right.
we
Right.
have to say what is normal is what is normal. And that
Yeah.
is what is normal, biologically, developmentally speaking. And
Right.
then what do we do with that as a parent? That's where values and informed decision
That is
making
informed
come
consent.
into
I
account,
yeah, I
right?
think that's such a solid point that we should arm parents with that information so their expectations are correct. They have that basic information and they don't then either point to something is wrong with me or something is wrong with my baby, which I feel like, not to overgeneralize, but that's where it lands, right? My baby's
Yes.
waking up all the time, they're 8 weeks old, something is wrong. I'm doing something wrong or something is wrong with my baby. No, your baby's 8 weeks old, right? Let's work with that so that your system is doing well in the reality of what an 8-week-old baby's sleep looks like. But I agree with you. And I mean, I think we could do better with that. We could do better as providers with either making sure we're educated or making sure we are referring people to people who are educated and giving the parents that information when if they're pregnant or however they're having adding to their family, so that they know what to expect and can prepare themselves emotionally, physically,
Yeah.
everything.
Yeah. Because like developmental norms are not a judgment on anyone's parenting style. They're just that foundation, right? Like this is true, regardless of what anyone thinks about it. This
Mhm.
is the range of what is typical.
Right.
And then we have the stuff that we can control to maybe shift some patterns. And then we have the stuff that we can't control.
And we have to work with how we emotionally handle that.
Yeah. And I feel like that's parenting, but I mean, it's sleep because sleep is so cute in the early years, but like that's your entirety of parenting.
That is
Right?
exactly
Like it doesn't change when your kids are big. You still have the things you can control, the things you can't control. Like,
that is, oh my gosh, I feel like you learn different lessons of that every day as a parent. But yeah, right, there's a lot you can control and mold, and then there's a lot of like, how do I parent and support the child that I have, whatever we're talking about, sleep or anything else. And
yeah.
that's hard, right? That's one of the hardest tasks as parents, but that's our task. That's what we're doing as parents. So
Mhm. And I
I'm with
feel like
that.
when we're thinking about that, again, back to that dichotomy of baby sleep versus parent sleep, I feel like the more we're able to understand our child and ourselves, the more we're able to find balanced solutions,
Absolutely.
right?
That's
You
such a good,
know?
yes, yes.
And the more that, assuming we're in a two-parent household, right? If we have a partner, the
Mhm.
more that we can respectfully talk about our needs with that person, the more that we can find a balance
Yes,
that we're
yes,
supporting each other,
yes,
right? And
yes.
that is going to look really different family to family. And it doesn't always mean that we divide and conquer sleep equally. It just means that we have balance and equity in the work that we're putting in and recognizing what the other people are doing, you
I
know?
would totally agree. And I would say, not that equity as a concept is so hard, right? Like,
Yeah,
that like things are never always equal. And
exactly.
so I think that one drives me nuts as well when I have couples who are sort of end up positioning themselves again against each other. And it's like, no, your needs are different, right? It's not always going to look the same. But yes, setting folks up for these flexible, supportive conversations, if particularly for folks who have a partner or somebody else who can help them, is absolutely essential. So again, we are considering this dynamic system where
Yeah,
everyone's needs matter and everyone's needs are always changing. I think that's the bottom line on this.
I know. I say that's like the best way to, I feel like to wrap up the conversation, which
Right?
I could
We
keep
feel the
talking
end of this.
forever, but like that's so true. That is so the bottom line. Like that systems look, that everyone's needs are important, needs change. We have to keep re-engaging and connecting, and
Got it.
the fluidity and flexibility, it's so important.
So important. Oh my gosh. Well, we can always have a part two if there's more there's always so much more to talk
For
about.
real.
I'm just so delighted to have the opportunity to talk about this with you and to get into the nuance and collaborate on what I'm hoping is really helpful information to parents.
Yeah, thank you. And I'm gonna put in the show notes, but if you want to shout out sort of where folks can find you.
Absolutely. Dr. Emma Basch is an associates is the name of my practice, but on most social media, it's just at Dr. Emma Basch, Twitter, Facebook, Instagram. You can find my practice there. Please reach out. We are always trying to help folks however we can. And if we can't help, we are very committed to making sure people get referred to appropriate care. So if it's not us, let us help you find somebody who can help you.
Awesome. Thank you so much.
Absolutely, Kim. It was great to talk to you.
Thank you for joining me today. I hope this episode left you feeling more informed, confident, and encouraged on your sleep journey. And just a reminder before you go that nothing in this episode is individualized to your specific sleep situation, nor is it to be taken as medical advice. Take what resonates, ignore what doesn't, and check with your healthcare provider about any medical concerns. Take a moment to subscribe to this podcast so that you'll never miss an episode. And take a moment to rate, review, or share an episode you love on social media. All of that helps parents just like you find me, this podcast, and this gentle and responsive sleep information. I'll see you next time.